Tonight, an exclusive 5-month investigation uncovers one of the deadliest secrets in hospitals nationwide. It's not botched surgeries. It's not even risky procedures.
On your side, Chief Investigator Ron Regan joins us tonight. And Ron, you're finding thousands of avoidable deaths are happening in hospitals across the country.
Well, that's right. These are patients who are recovering so well, they're back in their own hospital room, talking with family members. But we found far too many are dying within hours, and hospitals are failing to rescue.
I just describe it as half my heart died when she died. Because she was my right arm. Her and I were really close.
Amanda was just 18 years old.
She had got accepted to the local university, Indiana University.
There was a whole future ahead for her.
Very definitely.
But that summer, strep throat sent their daughter to the hospital.
The nevers are what's hard. He'll never walk her down the aisle. I'll never get to pick out a dress. I'll never hold her children.
Something went terribly wrong.
We got a phone call that she was dead in bed and they were doing CPR on her.
Dead in bed. It's how hospitals describe dying suddenly and unexpectedly. And we found it's one of medicine's best-kept secrets.
This sort of flies under the radar, and that's well known.
Dr. Frank Overdyke is a nationally recognized anesthesiologist. Are hospitals fighting to keep these deaths from going public?
Certainly, it does not bode well for the reputation from a marketing standpoint in a competitive healthcare environment to have unexplained deaths, which is essentially what these are.
Our 5-month nationwide investigation found it's not happening during surgery or in recovery rooms, but instead here in hospital rooms and floors where complications and risks are judged the absolute lowest, often within hours of family, flowers, and cards. Could this have been prevented?
Absolutely.
Yeah, definitely. I mean, we feel 110% it could have been avoided.
Prevented with basic technology similar to this. $25 at drugstores. An alarm sounds when breathing slows and oxygen in the bloodstream reaches critical levels. Technology both doctors and hospitals have known for decades. But instead, we found lives are being left to chance.
Everything was perfect. The surgery went well.
Marty Schmidt's wife was back in her hospital room.
She told me they found Jean not breathing.
So was Bill Neckerman.
They found him cyanotic, so that means he was blue. And his heart eventually stopped and they did a code blue.
Brain damage so severe, his family made the painful decision to remove life support.
This didn't have to happen.
Oh no, this was absolutely preventable.
Preventable because we found hospitals and doctors already know what's causing so many patients to simply stop breathing.
And what we know about opioids is that they can depress breathing.
Opioids are among the most powerful painkillers used following surgery, providing too much pain medication.
Well, in retrospect, too much pain medication.
Plus, we found hospitals actually profit when patients are kept pain-free. That's because patients grade hospitals on how well their pain is managed. Higher scores mean millions in federal cash, placing patients at risk.
The safety issue that we're dealing with is what we call a gap between what we do and what we know.
Especially deadly for an estimated 40 million Americans suffering sleep apnea. It's signaled by chronic snoring, but our investigation found hospitals across the country are failing to continually monitor patients.
People are denying that it's happening, and yet every hospital I've given a talk in about the risks of opioids, they've come up to me afterwards and said, yes, we had a patient just a month ago who we found dead in bed from respiratory depression.
Dr. Michael Ramsey heads up anesthesiology at Baylor Medical Center in Dallas.
This is something that's entirely preventable, and it's something that we need to stop.
But it hasn't. We found as many as 50,000 have died or suffered serious brain injury over the last 10 years.
This sort of collateral damages or whatever cost of doing business, whatever you want to call this, is unacceptable in our healthcare system.
If you have the capabilities and you have the machinery, use it. I don't want anybody to lose a loved one to something that's preventable.
Only University Hospital's Geneva Medical Center is protecting patients with the type of continuous monitoring of all surgical patients that can save lives. Now, you can check out our website at news5cleveland.com to learn a lot more about the policies at both the Cleveland Clinic and Metro Health Systems. Plus, you'll learn much more about these tragic but preventable deaths. I'm Chief Investigator Ron Regan.